Hello people, today's class will be on the continuation of internal genitalia part 2. So I'll recap what we learned about in previous class. So we learned about the uterus and what are its layers. Then we learned about the position of uterus. Then isthmus, what is the size in non-pregnant and pregnant women. Then we learned about the cervix. Then we learned it has two layers, endometrium and ectometrium, ectocervix, endocervix. And then we found a TZ zone, the transformation zone, which is most common for carcinoma of cervix. And this is HPV by HPV, not HBV, HPV. Okay, next we learned about the blood supply, and then lymphatic drainage and nerve supply. Then we later came on to fallopian tube. Then fallopian tube, we spoke about all the parts of fallopian tube and the blood supply. Okay, then we spoke about what are the dual blood supply importance, and it is a drawback or advantage. So it was a drawback as we spoke in last class. So now we'll talk about cervix. But one part I forgot to mention last class, cervix. So how do cervix looks in nulliparous women? It is like a pinpoint type or circular type, and in multiparous women it looks slit like. So this is because she undergoes vaginal delivery. But if it is in nulliparous and multiparous, so now if this multiparous women can also have circular type of slit, circular type of opening, if she has undergone LSCS instead of vaginal delivery. So now we move on to today's topic, that is vagina and ovary. So we'll talk about vagina first. So vagina makes an angle with the horizontal. It is not a straight or horizontal. It makes an angle with the horizontal. Okay, it makes angle with the horizontal, that is 45 degrees. So it has two walls. One is anterior wall that is 7 centimeters, and posterior wall, being more deep, is 9 centimeters. So this is anterior wall, this is this is posterior wall, and this is anterior wall. Okay, one second. This is posterior wall and this is anterior wall. Okay, then we have fornices. So it is 9 centimeters, 7 centimeters. Then we have fornices. So fornices will be here. It is more deep. Posterior fornix is more deep because posterior wall is more lengthier, and anterior fornix will be less deep. So posterior fornix deeper, anterior fornix, and then we have other two fornix, that is lateral fornix. So there are 4 fornices. Now we'll talk about relationship of vagina. So anteriorly, upper 2/3, it has bladder. Then we talk about lower 1/3. It has urethra. Then we'll talk about what is posterior relationship of vagina. So posteriorly, upper 1/3, middle 1/3, and lower 1/3. So here we have POD, pouch of Douglas. Then we have rectum in middle 1/3. Then we have here perineal body. So if you can imagine this, POD, rectum, and PNA body being the lowest part. So we have lateral relationships also. Laterally we have McEnroth's ligament. Levator anemasal. Then bulbocavernous. Then vestibular bulb. And Bartholin's gland. These are the lateral relationships of vagina. So from coming up to down, it is in order, okay? From up to down, these are the relationships of lateral wall of vagina. So McEnroth's ligament, levator ani, bulbocavernous, vestibular bulb, and Bartholin's gland. So we'll talk about what is McEnroth's ligament. So above it has passage of uterine artery from lateral to medial. Okay. Below we have ureter. So it is sandwiched between, ligament is sandwiched between uterine artery and ureter. So this type of sandwich is called water under the bridge. Imagining McEnroth ligament being the bridge and the water being the ureter, and above this being the open space of the sky. So water under the bridge. Okay, now we'll talk about persection of vagina. So it is head shape. The vagina is cut, and then the head shape will be formed. And what is the epithelium of vagina? So epithelium of vagina varies. Okay, so at birth we have transitional, and at adulthood we have stratified squamous epithelium. So vagina has transitional epithelium at birth, and adulthood it has stratified squamous epithelium. And vagina has 3 types of cells. So we call these cells in maturation index. Okay, maturation index. So it has 3 types of cell. One is parabasal cells. Next is superficial cells. Next is intermediate cells. So parabasal cells are seen at menopause, and it is estrogen dominant, and it is progesterone dominant. So now we'll talk how parabasal cells are. So in smear we'll take them. Okay, in smear we identify the cells in the fashion PSI. This is called maturation index. So before ovulation the parabasal cells are 0, these are 70, these are 30, taking percentage. Okay, in percentage I'm taking the cells, so 30 and this is 70 in intermediate cells. So at birth and after ovulation, before ovulation, before ovulation, so after ovulation it is 0, it is 40, it is 60, because progesterone dominates after ovulation, but before ovulation estrogen dominates. Okay, and the spears are taken from lateral fornices. We talked about lateral fornices earlier. There are two lateral fornices. So spears are taken from lateral fornices. Okay, now we'll talk about pH of vagina. A very interesting topic. I'll explain it in a very easy way. So what is pH of vagina? So pH of vagina. So pH of vagina is maintained by lactobacillus or Doudonese bacilli. So lactobacillus or Doudonese bacilli, which helps in conversion of glycogen to lactic acid, which decreases the pH. Okay, there is one more hormone that helps in conversion is estrogen. Estrogen also helps in conversion of glycogen into lactic acid to decrease the pH. So we can tell that if estrogen levels are high, then the pH is low. So estrogen is inversely related to pH. So next we come about a few examples. What is the pH in newborn? So in newborn, the pH can be, as estrogen level are normal, the pH will be nearly 5 to 7. It is acidic. Okay. In estrogen normal. It's not much change. So now in puberty, estrogen levels are there is acidic shift from alkaline to acidic shift because estrogen levels are high here. So alkaline to acidic shift. In adulthood or reproductive age, it is acidic. It is 4.5 to 5.5. In menopausal, it is 6.8 because estrogen levels are low. In pregnancy, the pH is 3.5 to 4.5 because estrogen levels are high in pregnancy. Okay, so now we'll talk about blood supply of vagina. So it has vaginal artery, middle rectal vein, middle rectal artery, internal pudendal artery. Okay, and lymphatics. So upper vagina, we have iliac lymph nodes. Middle vagina, we have same iliac lymph nodes. Lower vagina, superficial inguinal lymph nodes. So you have to remember that in lower vagina we have superficial inguinal lymph nodes. It's an important MCQ. Then coming to nerve supply. So we have sympathetic and parasympathetic nerve supply from S2 to S4. But here also the lower part is supplied by pudendal nerve. So you have to remember always that the lower part has different lymphatic supply, different nerve supply. Okay, so now we'll talk about ovary. So ovary size is 5 into 3 into 3 centimeters. Volume is 3 ml premenarche. Reproductive age postmenopause. And we have 3 ml, 10 ml, 8 ml. Okay, then we have about how are our ovaries descended. Just remember that there is something called gubernaculum which helps in descent of the ovaries. And this converts. This is at birth. This is in the intrauterine life, and at birth it converts to anteriorly round ligament and posteriorly ovarian ligament. So you know the origin of round ligament and ovarian ligament. That is from gubernaculum. So now we'll talk about ovarian fossa. Boundaries. So anteriorly we have umbilical artery. Posteriorly we have iliac vessels. Medially we have ovarian ligaments. Okay, then relationships. So medially we have ovarian ligament. Laterally we have infundibulopelvic ligament. Okay, which is attached to lateral wall of pelvic wall, laterally to pelvic wall. And below we have mesoovarium. That connects broad ligament. So now we'll talk about the blood supply. Ovarian artery. It is a direct branch of abdominal aorta. Then specifically we'll talk about its venous drainage because it is unique. So left ovarian vessels, right ovarian vessels. So left ovarian vessels goes to left renal vein, and right ovarian vessels goes to inferior vena cava. Then we'll talk about lymphatics. Para-aortic lymph nodes. So this was about ovary and vagina. Any doubts, mention in the box, and happy learning.